In his briefing moments
Thank
ago,
you.
the New York Governor, Andrew Cuomo, also said that the Javits Center in New York City will be essential to handle the influx of COVID-19 patients this week. He's asking President Trump to also allow the USNS Comfort to handle COVID-19 patients as well, which was not the original plan. Together, that would make a total of 3,500 new hospital beds in New York City, the epicenter of the pandemic. The Army Corps of Engineers is leading the expansion effort. Joining me now is its Commanding General, Lieutenant General Todd Semonite. General, thank you very much. Kudos to you and your extraordinary teams. I watched the way you first explained this when I first saw it was on Rachel Maddow's show. Tell us how you've been managing to do this, to not only step up the Javits Center and also Dallas, Louisiana, other large convention centers, but also giving plans out, prefab plans, if you will, for other communities, smaller communities, to put these pop-up hospitals together as well.
So, Andrea, thanks for having us on to be able to explain this. And before I get into the answering your question, I just want to say that the thoughts and prayers of all of us in the Department of Defense to go out to all of those families that are so affected by this virus. And we're just so proud to be able to work on this this unbelievable team to try to mitigate the bed shortage. You talked about the plan. 3 weeks ago today, Governor Cuomo asked to be able to help mitigate the bed shortage. I kind of explain this as the 3 S's. The first S is we have to worry about the sites. In other words, where do the beds go? The second S is obviously the supplies, and you're very aware there's an awful lot of issues with supplies. And then that third S is really the staff. So all 3 of those working together, come to a solution. So when the governor asked us for help, instead of trying to figure out how to build a hospital in the middle of a field, we said, let's go into an existing facility. And we really are breaking these down into COVID and non-COVID, and at the same time, a contained space like a hotel or a dormitory, or on the other hand, a convention center or a field house. So then we came up with a standard design, and we knew coming in, this is such a complicated issue, we need a very, very simple solution. So we took that standard design, and then we sent it out to our 43 different districts in the Corps of Engineers, and we said, go see the local mayor, go see the governor. What is best for them? What is their plan to be able to deal with the patients? And then how is we in the Corps can give them some technical solutions? And then I think you hit a key point. This doesn't mean the Corps of Engineers has to necessarily do the work, but the more we can leverage that standard design and give a town, especially a smaller town, a way of doing it, then they could actually contract a lot of this by their own. I'll give you some new numbers, and they just in our summary over the weekend. But right now we're building 15 different facilities. The total amount of beds is about 14,800 in those 15. And in the next 72 hours, we hope to be able to award about 18 more contracts with a rough order of magnitude about 6,000. So we continue to bring beds on. It's all 50 states and it's all the territories.
And the military personnel are also moving into some of these facilities as well. We saw the president announce that as well. What about the equipment, the ventilators, the PPE?
So, Andrea, I pretty much stay in my lane of worrying about the beds. Again, it really goes back to the local, the states, to be able to work with FEMA and to work with HHS to be able to identify that requirement. Dr. Esper has made some decisions to deploy certain military units in certain installations. They will bring some of that equipment as well. But I would continue to say I'd refer those questions back to either the state or local officials, because we're really focused on the bed shortage and getting the hospitals built.
Well, it's another tribute to you, your team, always ready, always there for us. Thank you so much, General. Thanks for taking a little bit of time.
I just want to say, you talk about
appreciate it.
You talked about the team here.
Go ahead.
It really is everybody coming together. It's city, state, the federal government. The president has told all of us, whatever we need to do, you go all in, because this is that important for this country, and we're doing exactly that in the Department of Defense.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.